The FDA officially recommended to reclassify the first batch of peptides, which is the main batch that affects Hims and Hers. So I'm going to go over exactly what happened and what it means for Hims and Hers, the company, and Hims and Hers, the stock, and us investors. Let's get into it. All right, so I'm going to go over the good news and some bad news, because there is some bad news with this, but I'm mainly going to just go over what happens after the FDA peptides meeting, with the business, with the stock. So let's kind of get into it. Please give me a like and subscribe. I really appreciate it. So the Pharmacy Compounding Advisory Committee voted narrow 8-6 split decision to recommend loosening restrictions on popular unapproved peptides. So basically they voted 8-6. And it was a wave of reviewed peptides, specifically BPC 157 and KPV. So these are the ones that Hims and Hers will probably be using the most, to the 503A bulk drug substance list, right? So one thing that's not so great, I guess, is the scientific stance. In briefing documents, the internal FDA scientists unanimously recommended against these peptides. They maintain that there is scant evidence and a severe lack of human clinical trials to prove for safety or efficacy. Now, even the traditional medical experts on the panel, alongside patient representatives, voted against the measure. They warned that allowing these substances to be injected without standardized safety data bypasses necessary public health guardrails. Now, to be honest with you, there's a lot of medications and medicines and stuff that you can take that's not been approved for all of these things. But at the same, it's one of those, like, I do want to make sure it's safe, right? We want to make sure it's safe. CEO Andrew Dudum, he said he wants to make sure that Hims and Hers provides a safe product. At the same time, sometimes it takes a long time to get these things approved through the FDA and all of that, right? There's a lot of things that are not FDA approved that you can buy. So the market shift. The split decision is a massive win for the peptide industry and compounding pharmacies, Hims. So it could immediately validate a $2 billion to $3 billion telehealth market. I mean, it's basically saying immediately it opens it up, right? Now, obviously, you need to get a few things in order. It's not right away, but I mean, it is within the months. Some more bad news, though. However, the FDA's official administrative and regulatory decision will take months or longer to finalize. Remember, this was just a recommendation. This was not a final decision. The committee's votes are advisory only. The U.S. FDA makes its final regulatory decisions independently. So, formally adding any substances to the 503 bulk list requires a formal proposed rule, public comment periods, and a final rule, a timeline that legal experts estimate may not even wrap until 2027 or 2028. Could you imagine? Could you imagine we have to wait till 2028 to see peptides in the Hims products? That would not be good. So let's go over quickly the peptides business and what we can expect from the timeline. Again, it could take months all the way up to 2028. We don't know yet. We don't know exactly what's going to happen. We do know that it's run by Kennedy, right? So he's going to want to get it through, and they're the ones that are going to be kind of making the final decision. So people kind of, are estimating that it will get approved anyway, but it still might take a while. So the peptides business itself, right? If the FDA actually clears peptides, it will trigger a major paradigm shift in direct-to-consumer healthcare. So it fundamentally changes the economics and access of wellness medicine. So now we're going out of the gray market, right? Right now, if you want peptides, you have to get it from the guy under the bridge. You don't know what's in there, right? I'm just kidding. You can get it online from other safer places. But there's people who are getting it. I've seen, I saw this post of someone had it like a sticker, like a bumper sticker, but it was on their window that like, oh, if you want like this thing, it was just crazy, right? That's how they're doing it. And then there's also the expansion beyond weight loss. Now, if you don't know, GLP-1s, right, the semaglutide, tirzepatide, those are peptides. Those are approved. All these other ones are not approved. Now, BPC 157, TB 500 for tissue repair and recovery, right? You have all these other ones that are used for these other conditions. So it's going to be great to be able to, treat these conditions with a new medicine, not new medicine, but a medicine that will be now approved. And then the supply chain bottlenecks, obviously the demand initially will just skyrocket and there will not be enough supply. That will help HIMSS in a way because they will probably be the ones in supply the most. They already have a compounding facility, so they're going to be able to get, once they get their hands on the peptides, and then they can start going immediately. They will be able to, HIMSS is going to be the one with probably the most supply and the first supply, which is great because the demand will still outpace supply. So they're going to be able to sell out immediately. And then strict regulatory oversight on claims. Now the FDA will enforce strict marketing guardrails, right? You can't just say peptides are FDA approved cures and this and that, right? It's not going to happen. But eventually, even if it's not FDA approved, you can still do it, right? Now this is just reclassifying them. It doesn't mean that they're necessarily approved yet for whatever product it is. But having it be available, right, so that these pharmacies can compound it, makes it, so that these companies can offer it. So now the HIMSS and HERS, they'll enter the peptide business. Now they are uniquely suited to turn this regulatory green light into a massive business line. Their existing playbook from GLP-1 weight loss, hair care, and sexual health gives them an immediate head start, plus their facility already, right? HIMSS already possesses the digital infrastructure for patient intake, medical evaluation, and prescription fulfillment. They have medical screening protocols and safety framing, right? They have all this stuff online that you can do your lab work. I'm actually late on my lab work. I need to do it already, but it's been a crazy little while. But they make it easy. Now, they also have their vertical integration where they don't have to go outsource like now that they have to do with Novo, right? And Wegovy and all that. So to capture the maximum margin and control quality, HIMSS will lever its existing 503A and 503B pharmacy partnerships and internal fulfillment networks. So now they don't have to rely on other drug manufacturers, right? Like Novo and stuff. They can compound their own. This will keep their prices competitive while maintaining high gross margins, right? That's what you want. So that's going to be good. It might not happen tomorrow, but it'll happen in the next year, right? Rather than selling isolated chemical names. Now, this is another thing too. A lot of people will go out and buy BPC 157, right? They'll go out and buy TB 500. You're going to go to HIMSS and you're going to buy the joint recovery pill, the muscle recovery pill, the injury recovery pill, right? The men's fitness and recovery subscription. They're not going to package it like a sign, like if I was like, oh, hey, buy this, you might be like, well, what's that, right? Even me, like I haven't taken any peptides, which I probably should with the injuries I've had. I fell off a cliff over 100 feet. My whole left side got all messed up, and I have still, this was about 7 years ago, so I still have some issues. So I would probably benefit from some of this. I haven't taken any, and it's probably because I'm like, I don't know if it's safe. Gray market, BP 157. What is that? Give me a name, right? give me a weird name. Just give me something. I don't know, but I would see even myself if they're like, oh, it's a men's recovery, this and that for your joints, and then I'm like, oh, okay, fine. It's just different. So by turning episodic treatments into monthly subscription regimens, like with the recurring refills and dosage adjustments, HIMSS can scale peptide revenue rapidly, converting low-margin single purchases into high lifetime value subscriptions. Right. So right now, again, peptides is basically all good news in terms of the business and HIMSS. HIMSS is in perfect place to do what everyone wants and all the investors want them to do, right? Is be able to start making more money again, start growing their revenue. Well, they're going to be in prime position to do that with peptides. So now the financials behind it. If the FDA approves it, the financial impact on HIMSS and HERS would be transformative. Now, they have taken the strategic pivot towards branded weight loss offerings, right? In early 2026 with Novo. Now this will be unlocking custom compounded peptides, and it provides a high margin engine to accelerate their path towards their $6.5 billion revenue in 2030, because that's what they've been saying for many quarters now, is that by 2030, they want to hit $6.5 billion in revenue. Now, in order to do that, they have to think of some catalysts, right? Because the way that the revenue has been growing, there's no way it would have reached that. So they have to have some kind of catalyst, and I do think peptides is that catalyst. The fundamental financial appeal of compounded peptides lies in their gross margin profile. Sourcing active pharmaceutical ingredients for compounded formulations allows Hims to capture far higher margins than reselling branded pharmaceuticals. Essentially, just like what they're doing with Wegovy, right? They wanted to sell their own weight loss, and they couldn't because of all the FDA and the legal and this and that, right? So now they have to sell Wegovy from Novo. Novo makes it. And so that's like selling lemonade that you had to go buy first at Ralph's or your grocery store, wherever you buy, right? You buy lemonade there, and then you start pouring it into a glass and selling it, right? It's a lot cheaper if you just have a lemon tree and you're the one who's growing it at first. Hims is now going to be able to do that. Hims is now going to be able to just make it themselves, like what they do with all their other stuff, right? They compound it themselves, and they can make a way higher gross margin on that and make a lot more profit. So you can see the gross margin comparison and the average revenue per user. This is big too, right? So the branded GLP-1s, right? They make about $250 to $300 revenue per user, but they're also only getting about 35 to 50%, right? Even though there is an average revenue per user a little bit less with peptides, it's a lot more than the hair and erectile dysfunction and all that. And you're getting a 70 to almost 80% gross margin. So you're keeping a lot of this, right? Now you may not be, we're talking top end, right? 350, that'd be $150, right? They end up getting, right? If they had if Hims was able to sell Wegovy at the highest price of $300 and they got the highest margin of 50%, that means they made $150 on it. If you take 180 and you do about 80%, what? That's divided by 10, 1 minus 36 is 144, right? So basically the same, right? You're getting about the same, except these peptides are going to be all different kinds of products, not just weight loss. It's all over the place, right? And the demand is high. So there's a few other things that are positive about this. Hims does not need to pay Google or Meta to acquire new customers for recovery or longevity peptides, right? They already have their 2.6 plus million subscribers. And of course they're going to still market and stuff, but they can now market to these subscribers very easily. Multi-category subscriptions. Now a subscriber paying $50 a month for hair loss or something like that can now be sold something more for joint repair, right? Now they're already doing that, but now with the peptides they can offer more. And it's going to improve their churn and retention. So basically when people just want to start something, they try it for a little bit and then they leave. The peptides therapy, usually the recovery is fast. Apparently peptides, again, I haven't had any, apparently peptides work quickly. And so what that does is that's going to help keep someone on the plan, right? If you do not see results quick, you might just bail out before you even have the time to see results, right? They say when you want to go to the gym, you don't go for 24 hours straight. You don't go for 48 hours straight. No, you go for 6 hours over a period of, whatever it is, 14 days. You know what I mean? So it's like, that's what you'd want to do. And, so Hims is, if they're able to provide peptides, people are going to be seeing fast results and then wanting to stay on the Hims platform. They're also well positioned financially to fund the CapEx required for peptide manufacturing and compliance. They already have $750 million cash with short-term investments. They already have the vertical M&A, right? They already have these facilities and they have cash flow, right? It allows them to absorb testing, legal, and compliance overheads without diluting shareholders. So that's really good. Now, if they capture even 5 to 8% of their own subscriber base, they could easily add 250 to 450 million like this in high margin annual recurring revenue right away. Because cross-sold revenue carries 70% gross margins, a significant portion of peptide revenue flows straight to the adjusted EBITDA, right? So that's good. Now there's a few, I don't think we're going to end on bad news, but here's a little bit. When you see the red, it's a little bit bad. Now there's going to be FDA volatility. If the FDA suddenly reverses or tightens, compounding, right, like they did with GLP-1s, kind of, that really messed with Hims, right? Hims could face inventory write-downs. High-grade CGMP compliant peptide APIs are scarce, supply constraints could squeeze input costs, temporarily pressuring gross margin. So again, that's temporarily, so I'm not too worried about that. And then aggressive marketing claims, which Hims kind of does, around anti-aging or tissue repair could lead to regulatory warnings, increasing legal and compliance overhead, which also doesn't look good for the brand. People are tired of Hims being involved with the FDA, right? So where will the stock go, right? Oops, there we go. I wanted to show, here's the stock right now, right? We are at $32, almost $33, okay? I had drawn this out around here. I don't know. It felt like it's just going to keep doing this, and I don't even know why I made that big old balance. And maybe I just had an intuition or something, but I mean, I can see us, I'm a Hims investor. I can see this thing bouncing. Now, can it go to 40 within, what, is this like a week? No, that's not going to happen. That's not going to happen. But I could see this thing ending in the 50 range by the end of the year. This is right now on October 26th. I mean, if we want to go end of year, it'd be right here, right? So this is where I think we could end up by the year end, which still right now, and let's say it takes 158 days to go 72%. You ask anybody, you get 72% return on your investment in, what is that? Divided by 30 is 5 months. I mean, I think anyone's going to be taking that. I don't care if it's $1, if it's $100,000. You're giving me 70% return on investment in 5 months. I'm taking that. So that's just my opinion. I could be wrong. I could definitely be wrong. I didn't think Hims was going to go this low, and I didn't think it was going to pop up that fast either. I thought it was going to kind of remain here with that lawsuit. So I was very interested to see what happens. But anyway, I'm glad it did come back. My portfolio's been hurting. Today was a little bit better. But yeah, I do think Hims can reach, 50 by the year end. And yeah, so that's where I think the stock could go. I really appreciate anyone watching right now. Remember that it is not approved yet by the FDA. It's being recommended. These are scientists and all the FDA panel, all these people are just making a recommendation to what the FDA should do. Now, it is being headed by Kennedy, so he is most likely just going to go with what's recommended, and so far it's been recommended to reclassify them, which is good news. But there's no guarantee. So we have to keep that in mind, but I would put my money on it. That's what I would do, because I'm leaving my money in Hims. I believe over the next year or two, Hims their revenue is going to significantly go up, and they're not going to have a disgusting quarter. Their earnings is coming up too, and I do not think they'll have another quarter like they did last one. The last one was so bad with Novo deal and the lawsuit. It was very bad. But that's in the past. Moving on to the future. Peptides, here it comes. All right, so thank you for watching, and don't forget to subscribe and like, and also don't forget to earn it, save it, invest it, buy low, sell high. I want assets, not liabilities, and you can count on compounded interest.